precise delicate issue. يعني المريضة من تحكي عن ابنها ما عندها مشكلة، من تسألها ابنك يتحرك، عندك نزف يأثر على الطفل، ما عندها مشكلة. In this year you are gynecologist, so you speak about female herself. The objective to this lecture is to perform the medical interview and physical exam of women incorporating ethical, social, diversity perspective to provide culturally competent health care. Apply the recommended prevention strategy to women throughout lifespan. Apply knowledge of gynecological problem, history taking and clinical exam of a patient in gynecological department, communication and clinical skill. Why we speak about introduction to gynecology؟ مثل ما قلنا المريضة من نسألها عن ابنك إيش قد حامل، تنسفين أو ما تنسفين ما عندها مشكلة. Okay, no anything. So she speak about her baby. Now about reproductive organ, female reproductive organ. So this is delicate issue. Gynecology is the medical practice dealing with the health of the female reproductive system, vagina, uterus, and ovaries, and the breast. Its counterpart is andrology in now. Assessment of the gynecological history and pelvic examination is part of the assessment of female patient in many clinical contexts. Clinician familiarity with the gynecological evaluation can help reduce anxiety for both patient and healthcare professional. Okay, من تيجي مريضة عندها dyspareunia, so don't speak freely with you. So you should know how to take history and how to do examination. Gynecological history, the history should be obtained in a relaxed and private setting. Before the patient is asked to dissolve, قبل لا تسأل المريضة تحكي لك بصورة تلقائية, she should be interviewed alone. And under most circumstances دائما وحدها, في أغلب الأحيان هي وحدها المريضة. Unless there is a hearing or language barrier. Questioning should be proceed from very straightforward of objective information to more delicate issue. يعني ما أبدي أسأل المريضة عندك ديسبارونيا، عندك ديسمينوريا، لا. أسأل المريضة very straightforward, ask about, as you know, in the last year, name, age, occupation, address, then ask about what medical disease, then more very straightforward objective information to more delicate issues. يعني بعدين أرجع للdelicate issue related to her reproductive system. The provider should be evaluate and respond to the patient comfort level and make very effort to remain supportive. يعني شنو؟ evaluate and respond to the patient comfort. إذا أكو سؤال يحرج المريضة شوية أنسحب وأسأل سؤال آخر وأرجع أسأل نفس السؤال اللي أريد الانفورميشن عنه. One should be done in a history-ended question. أسأل المريضة من أردس أنا شنو الجاينيكولوجيست؟ العام تخرجنا أوبستريشن، هل السنة لازم ندرس شنو الجاينيكولوجي حتى تصير شنو جاينيكولوجيست؟ وإن شاء الله next year صف سادس أنتم تلمون المعلومات وتطلعون بنتيجة. One should begin with the history with an open-ended question. يعني أسأل أقولها okay, can you tell me about your menstrual cycle? Open question. إذا حكيت لي المريضة قالت لي أنا okay, the cycle coming every 24 days, coming, lasting for 5 days, وتحكي لي أول العام رحت للطبيبة وكانت السايكل irregular. So now stop, end the question. open, أسألها احكي لي in details، ومنشوف منشوف الكلام ابتعد عن الكويستشن مالتك شو تسوي end the question. That will illustrate the women gynecological concern. She should be encouraged to describe the situation in her own word، يعني بكلماتها without frequent interruption. ما تسوي هواي interruption، بس تقدر تسوي interruption اللي راح تحكي لك أشياء ما مفيدة إلك. maintaining eye contact، باوع بعين المريضة. nodding، تتحرك أو تنطي حركات إشارات بوجهك وإيديك. brief clarification، ممكن شو تسوي؟ توضيح بسيط للمريضة. brief clarification of important point. convey the provider attention to the women issues. The provider can then ask a question to proceed with the evaluation. basic history، basic gynecological history. menstrual history for all women، يعني بغض النظر عن العمر مالتها. age of menarche، onset of the first period. prior history of menstrual irregularity، عدم انتظام الدورة. prior history of menstrual irregularity عندك سابقا. prior history of heavy or intermenstrual bleeding. prior history of dysmenorrhea. So age of menarche, any menstrual irregularity, prior history of heavy menstrual bleeding and any dysmenorrhea. هاي أي مريضة بغض النظر عن العمر. women of reproductive age and the menopausal transition. date of last menstrual period, first day of the bleeding or spotting. date, okay, last menstrual period يعني شو وقت last menstrual period. if the cycle coming at night, if the cycle coming at night مثلا يوم 24 بالليل. so the first day اللي هو today، يعني مثلا يوم 24 بالليل وهي اجتك يوم 25. so the last menstrual period شو وقت؟ حتى لو spot، حتى لو نقطة. so the first menstrual period شنو؟ 25. إذا اجتها spot يوم 24، spot يوم 24 بالنهار واجت هي يوم 25، so the first day of last menstrual period تبقى يوم 24. even spot إذا بالليل نعتبرها على 25، وإذا بالنهار نعتبرها على 24 نفسه. date of previous menstrual period، هذا الشهر يوم 24 مثلا 9. اوكي، الشهر اللي فات شو وقت؟ 24/8 أو 23/8. we should ask.
نروح أركز بيه أحسن.
date current cycle length interval between last menstrual period and the previous menstrual period. okay, cycle length اللي هي interval between the last menstrual period and the previous menstrual period. طبعا هاي المحاضرة تعريفية لكل الجاينيكولوجي، and regularity cycle pattern over the past year. number of the days of bleeding in an average month. current or recent heavy or intermenstrual bleeding. current or recent postcoital bleeding. current or recent dysmenorrhea and presence of premenstrual symptom. This should be asked for reproductive age and menopausal transition. Postmenopausal women age at the last month، حتى أعرف هاي المريضة شنو postmenopause or not. so we speak about menopause later on. history of hormone therapy, any hormone replacement therapy. أي menopause، أي مريضة menopause we should ask about any history of hormone replacement therapy. obstetric history and history of any pregnancies. history of miscarriage, termination of pregnancy, ectopic pregnancy. history of assisted reproduction. for each pregnancy carried should date of delivery, gestational age at delivery, mode of delivery with indication for operative delivery, maternal complications such as hypertension or diabetes, fetal complications such as growth restriction, anomalies or stillbirth, delivery or operative complication and neonatal problem, current health of the children. وين أطفالك هسه؟ current symptom or history شنو تجيني؟ pelvic, vaginal or vulval infection, vaginal discharge, vulvar or vaginal lesion, fever, pelvic pain, abnormal genital tract bleeding, prior sexual transmitted infection, PID, pelvic inflammatory disease, how to diagnose, frequency and treatment. cervical cytology, pap test history, date and result of last test, diagnostic and follow-up of abnormal pap smear, history of other gynecological problem like ovarian cyst, uterine fibroid, infertility, endometriosis, PCOS, mode of diagnosis and treatment, symptom of pelvic organ prolapse or urinary or anal incontinence. هاي المشاكل اللي ممكن تجينا بالجاينيكولوجي. history of any gynecological procedure like what? DNC, removal of uterine content for various reasons including completing or partial miscarriage and diagnostic sampling for dysfunctional uterine bleeding, hysterectomy, which means removal of the uterus, or oophorectomy, removal of the ovaries, tubal ligation, which means permanent sterilization. هاي كل الجynecological procedure. Hysteroscopic inspection of uterine cavity, اللي هي hysteroscopic diagnostic hysteroscopy, laparoscopy in inspection of the pelvic through the abdomen to diagnose and treating gynecological disease. Laparotomy for any gynecological reason, we should ask. Cervical excision procedure and Pap test, Pap smear, date, indication and complication, screening for intimate partner violence, العنف المنزلي أو العنف الزوجية. So now speak briefly about anything we speak حتى تكون ملم بالمعلومات بالجينيكولوجيكال هيستوري. راح تاخذ بالمحاضرات الجايه كل اللي حكيناه، بس هاي محاضره تعريفيه للجينيكولوجي بصفتكم انتم العام درستوا الابستتريك فقط. Menopause is defined by 12 months of amenorrhea، 12 شهر amenorrhea after a final menstrual period. Postmenopausal bleeding refer to any uterine bleeding in menopausal women other than the expected cyclical bleeding that occur in women taking sequential postmenopausal hormone therapy. يعني المريضة تقول انت menopause or not, how to diagnose this is a menopause 1 year after the last menstrual period. ما عدا المريضة اللي تاخذ شنو HRT hormone replacement therapy، يعني تاخذ شنو drugs that sequential estrogen then progesterone so lead to withdrawal bleeding. هذا ما يعتبر شنو cycle, menstrual cycle, this breakthrough bleeding or withdrawal bleeding after HRT. While menopause may occur in some women in their 40s, okay, بعمر الأربعينات, other causes of amenorrhea and abnormal uterine bleeding should be considered, particularly for patients in their early 40s. ممكن مريضة بعمر الأربعين premature ovarian failure، ممكن شنو hysterectomize، ممكن bilateral oophorectomy for disease of the ovary. Sometimes patient presented with pelvic pain. The characteristic of pelvic pain should include the time, onset, duration, location, quality, and severity. And the relationship of the pain to menstruation، يعني إلى علاقة بالمنس, pre-mens or during menstruation. Physical activity or sexual activity، ممكن dyspareunia. And alleviation of the pain with analgesia. شنو أخذتي علاج or anti-pain stop؟ okay, paracetamol, codeine, or need non-steroidal anti-inflammatory drug or narcotic. So how to assess the severity of pain? Hormonal contraception or position change are useful component of the pain history. Associated GIT or urinary symptoms should be point to non-gynecological source of pain. However, ovarian torsion is often accompanied by nausea and vomiting. Urinary, sometimes patients come into gynecological department with urinary incontinence and pelvic organ prolapse. Urinary incontinence occur among women of all age and require evaluation when the involuntary loss of urine is bothersome. إذا سببت لها مشكلة تجي. Historical factors such as leakage of urine with physical activity, exercise, lifting, coughing, sneezing versus an overwhelming leakage of urine before reaching a toilet can help to differentiate stress incontinence from detrusal instability. A careful voiding and intake history will help the clinician determine the underlying cause. بعد المحاضرة هاي قلنا تعريفية لكل مواضيع الجينيكولوجي، حتى أنت في بداية الجينيكولوجي تعرف كل شيء، مو إلا أن توصل للمحاضرة على طول السنة. Women with pelvic organ prolapse may complain of vaginal bulge, vaginal pressure, or the need to place a finger in the vagina to void or defecate. هذول pelvic organ prolapse اللي نسميهم cystosil or rectosil. Sometimes use her finger to void or to defecate. Such symptoms should be evaluated further with physical examination. Sexual function. Many sexual problems result from and or cause reproductive dysfunction and gynecological problem. Sexual issues include prevention of STD, sexual transmitted infection, contraception, sexual dysfunction, and the prevention and management of any sexual assault. Do you have sexual consent? شنو أسألها؟ Are you currently having or have you ever had a sexual relation? Have you recently had any new partner or sexual contact? Do you protect yourself from pregnancy and sexual transmitted infection? Would you like to screen for sexual transmitted infection? Do you need contraception or pre-conceptional counseling? Are you currently experienced or have you experienced previous sexual abuse? شلون أسأل المريضة؟ هاي الأسئلة اللي أطرحها على المريضة. إذا مريضة اجتني with infertility. Infertility is defined as a failure of a couple to conceive after 12 months of regular intercourse. يعني هي 12 شهر من الزوجة with regular intercourse، مو رجلها مسافر أو ما موجود. Without using contraception in women less than 35 years of age and 6 months of regular intercourse without using contraception in women more than 35 years old and older. Before proceeding with an infertility evaluation, the provider should confirm that the couple is having regular, frequent intercourse during the middle of menstrual cycle. يعني 12 شهر من الزوجة أقل من 35 سنة عمرها with regular intercourse. Regular intercourse يمتى يصير؟ بالfertility الفترة الخصبة اللي هي mid cycle during ovulation. Once the diagnosis is established, the infertility history should be focused on 3 factors. راح تاخذون محاضرة الانفرتيليتي بس هاي تعريفية إلها. Ovulation, tubal, uterine problem, and male factor. أي infertility should evaluate ovulation, tubal, and uterine problem, and male factor. Pelvic examination. How to perform pelvic examination? يمتى أسويه؟ is indicated in any patient with genital or pelvic symptom and in the other patient for preventive care. يعني شنو؟ prevention for cervical cancer, prevention for breast cancer, prevention for ovarian cancer. Age at initial examination. منو إيش وقت أفحص بيا عمر؟ Pelvic examination is not included unless indicated due to symptom or for screening for sexually transmitted infection. اكو مرات مرضى يجون دكتوره شو ما فحصتي لي pelvic examination تقصد vaginal examination. So we speak you don't need. There's no symptom or no any indication for pelvic examination. Equipment. شنو احتاج حتى اسوي pelvic examination او how for preparation for pelvic examination. Patient consent. أي مريضة أريد أفحصها pelvic examination أو إحنا نسميها الفحص الداخلي لازم شنو؟ consent without anesthesia، بدون فحص تحت التخدير العام اللي هي شنو verbal consent، موافقة شفوية. ويا الانستيزيا examination under anesthesia موافقة كتابية written consent. The clinician should request permission before starting pelvic examination. Written consent is not required with the exception examination under anesthesia. Female chaperone should be present unless urinary incontinence or female should be asked to empty the bladder. يعني شنو؟ أي مريضة أريد أفحصها pelvic examination أحتاج منه؟ أحتاج female chaperone. ممكن إحنا إيش قلنا ألون اللي هي مثلا ما تريد تدخل وياها عمتها. ألو ألو.
نعم دكتورة واضح.
اوكي سو ايش حكينا؟ قلنا احنا بريسايز ديليكيت ايشو واغلب الحالات نحتاج الفيميل الون. when we want to do pelvic examination مثلا انت هسه طبيب ميل دكتور اوكي، ممكن gynecologist، ممكن oncologist. اوكي oncology deal with the anything. ايش تحتاج؟ اذا المريضه ما وياها مرافقه أنت شنو عندك مرافقة اللي هي شنو nurse any health professional أوكي personnel any health personnel sorry أي ممرضة لا تفحص البلفيك system unless there is a female chaperone إلا وياك بنية موجودة ممرضة طبيبة زميلة قابلة أي أحد لازم تجي شنو female أوكي unless urinary in كل المرضى من أريد أفحصهم pelvic exam لازم شنو empty bladder unless urinary incontinence لازم المريضة full bladder. Equipment. The basic equipment needed to perform a pelvic examination include an examination table with strap up or mean for elevating the buttock when strap aren't available. Patient is on stretcher or in a bed. Good light source. Cold light. يعني شنو ضوء بارد مو هذا الجلوب العادي هوتن. Speculum of appropriate size. Speculum. Sims or Cusca speculum حسب البودي ماس اندكس وحسب المريضة جايبة 1 جايبة 2 نلي بارا so appropriate size. Material to obtain cervical cytology لازم عندي material for pap test. Material to test for common infection chlamydia, gonorrhea, herpes simplex virus. Cotton swab for obtaining sample of vaginal discharge. pH indicator paper. A dropper bottle of saline and potassium hydroxide for performing web preparation اللي هي شنو test for infection. Test kit for fecal occult blood. Water soluble lubricant. Water soluble. Disposable gloves material to drop the patient يعني شنو حتى أغطي المريضة اللي هو gown أو أي شرشة. Component of the examination. The pelvic examination traditionally include the internal and external genitalia and pelvic organ. Comprehensive examination also include evaluation of some component of urinary and GIT, including urethra, anus, and rectum. A more comprehensive examination involving the abdomen, breast, and other sides may be indicated to provide complete primary care or to evaluate gynecological problems that involve other organ systems. مثلا مريضة CA ovary لازم أفحص supraclavicular, lymph node, breast examination, chest examination, more comprehensive. The abdomen. Examination of the abdomen should be performed using a standard technique مثل التكنيك العادي اللي هي بالباطنية وبالجراحة. Inspection, auscultation, palpation, and percussion. The examiner should observe for abnormality of the skin color, intestinal peristalsis, hernia, organomegaly, mass, fluid collection, and tenderness. يعني مو مريضة جايتني بالجاينيكولوجيكال ديبارتمنت أنا أعوف البالبيشن أو أعوف intestinal peristalsis أو أعوف الهرنيال orifice. So maybe patient have hernia and I want to do hysterectomy. So patient take general anesthesia or spinal anesthesia. So I can remove the womb or do hysterectomy and correction of the hernia. So anything. External genitalia. The external genitalia are inspected and palpated. The hair distribution, skin, labia minora and labia majora, perineal body, clitoris, urethral meatus, vestibule, and introitus are evaluated for any developmental abnormality. Skin lesion like discoloration, ulcer, blood, verrucous changes, excoriation, masses and evidence of a trauma or infection, partholene and paraurethral gland. The partholene gland opened are located in the 4 and 8 o'clock positioned just out the hymenal ring. هاي البارثولين gland 2 gland ساعة 4 وساعة 8 من الhymenal ring. The gland are not palpable when healthy, unless diseased, so palpable. Paraurethral gland or second gland are adjacent to distal urethra. The gland duct open into the urethra or just outside the urethral orifice. If enlarged or tender, an attempt should be made to express exudate which suggests infection. Speculum examination. The vagina is first inspected using a speculum of appropriate size, lubricated with warm water or a water soluble lubricant. Lubricant do not appear to interfere with the sampling for cervical cytology. ليش استخدمنا warm water أما ماء دافئ أو water soluble lubricant؟ ما نستخدم يعني oil or anything. Two, يعني don't interfere with the pap test or a result مال swab. A traumatic insertion is aided by assisted muscle relaxation at the opening of the vagina. This may be accomplished by advising the patient to relax her leg to the side and also by inserting a finger into distal vagina and gently applying downward pressure. The speculum is then inserted and downward pressure applied. The speculum is advanced in a direction free of resistance. يعني مرات مريضة free of resistance شنو أقصد؟ مرات مريضة عندها adhesion previous surgery so anteriorly adhesion so there is a resistance so posteriorly no resistance so I direct the speculum in the direction free of resistance هذا معنى. And open as the apex of the vagina is reached. Apex of vagina شنو بيها؟ بيها cervix so I visualize the cervix then open the speculum. Vaginal lesion anomalies, atrophic mucosa are noted. If abnormal discharge is identified, the volume, أي discharge لازم أشوف الvolume, الcolor, consistency, odor should be noticed and sample taken with cotton swab. The pH, physiological vaginal discharge شنو acidic, less than 4.5. And elevated pH may be due to what? Infection, bacterial vaginosis, or exogenous substance like semen. The degree of vaginal wall relaxation and uterine prolapse is evaluated if indicated. إذا المريضة جايتني المشكلة مالتها شنو؟ genital organ prolapse, so the degree should be evaluated. Prolapse is if indicated by removing the top of blood of the speculum. يعني شنو؟ هي by cusco speculum, so remove the top الطبقة الفوق of speculum and using posterior blood as the retractor. أو ممكن إذا هذا كاسكو أشيل الطبقة الفوق أو سمس speculum اللي هو بيه بس retractor واحد. It's helpful to ask the patient to bear down to determine the degree of uterovaginal descent. Lesion or discharge of the cervix are noted. Cervical culture and cervical cancer screening is performed as appropriate. High examination of the vagina by manual examination اللي هو شنو by manual إيديا اثنينهم. The index and middle finger of the dominant hand are normally used to examine the vagina and the uterus. هسه سويت inspection of the vulva by my eye by to inspect the skin changes, discoloration, excoriation, ulceration, then inspect the vagina by speculum examination اللي هو cusco speculum. Or inspect or assessment the degree of genital organ prolapse by using single blood retractor يعني جهة واحدة. By manual examination شنو أفحص بيها؟ شنو أفحص؟ اليوترس, the direction of the uterus and the size of the uterus and ovaries, الأدنكسية. Index and middle finger of the dominant hand are normally used to examine the vagina and uterus. Although some providers find that switching hand during the examination facilitates evaluation of the adnexia. Only a single finger can be inserted comfortably in a patient with narrow introitus. يعني مو إلا الإندكس والميدل finger. Sometimes we use single finger. The abdominal hand, الإيد الثانية, the abdominal hand should be used to sweep the pelvic organ. هي pelvic part maybe above, okay, maybe above. So the other hand sweep up, يعني شنو sweep down, أنزل بيها pelvic organ حتى أحسها بمن بالdominant hand اللي موجودة بالفاجينا. Okay, downward while the vaginal hand is stimulating elevating them. الإيد الجوة ترفع pelvic organ and الإيد الفوق شو تسوي لي بالابدومن الاذر هاند؟ احنا قلنا هاي باي مانوال، شو تسوي؟ تدفع لجوا. اوكي so I want to palpate the uterus and the adnexia. The uterus is assessed for the size, shape, symmetry, mobility, position, and consistency. The uterine size and consistency vary according to reproductive status, puberty, menopausal status. In term, to describe the axis of the uterus is the same as the vaginal axis. Version, position of the entire uterus related to the axis of the vagina, anteverted or retroverted. الانتاير يوترس اوكي صاير anteriorly شو نسميه هذا anteverted. الانتاير يوترس toward the rectum شو نسميه retroverted. Flexion, the position of the fundus related to the axis of the cervix. Okay, the position of the uterus, علاقة اليوترس ويا السيرفكس شو يسموها axis or flexion. Antiflex or retroflexed. The adnexal area are checked for the presence of appropriately sized mobile ovaries, which is about 2 by 3 cm, which are normally somewhat tender. يعني تتألم المريضة من أحس الأدنكسية. Somewhat. Palpable ovaries in both menopausal women are not a normal finding. يعني ما أحس الأوفريز لأن يصيرون atrophied. And sometimes detected in 30%, which require investigation. In investigation شنو أحتاج ultrasound. So by manual examination, I assess the disease of the uterus and the adnexia. إذا حسيت هي post menopause, palpable ovaries or adnexia, so I check by what? Investigation. ممكن مرات ما عندي investigation. Okay. The ability to palpate the ovaries during a clinical examination in the office depend upon several factors including patient body habitus. يعني السمينة كلش ما نحسها. Examiner experience. مثل طبيبة جديدة بعد معتها training بالexamination of the ovaries and الأدنكسيا واليوترس ممكن ما تحسها وتقول علموني أو ساعدوني شلون أحسها. The time taking to perform the examination يعني بسرعة تفحص أو تاخذ وقت بالفحص. And the presence of other pelvic abnormalities ممكن previous pelvic adhesion or any operation. Ovaries can be difficult to palpate even by experienced clinician under ideal circumstances. يعني ببعض الأحيان ما نحس الأوفريز. Rectovaginal examination is another examination in gynecology. Rectovaginal نفس الوقت نفحص الركتم والفاجينا. Another potential component of the gynecological assessment is the rectovaginal examination. This allows optimal palpation of the posterior cul-de-sac. أخذته بالanatomy. Cul-de-sacs, posterior cul-de-sacs and uterosacral ligament as well as the uterus and adnexia. It performs as an alternative to vaginal examination in children. شو نسوي rectal examination. And adult never have sexual activity اللي هو virgin شو نسوي rectal examination. Or sometimes we combine rectovaginal, one finger in the vagina and one finger in the rectum. Will help to pick up pelvic mass. Okay, imperforated hymen. ممكن مريضة تجيني imperforated hymen. إيش أفحص؟ rectal examination to assess the degree of collection of blood. أبدأ أشوف الobstruction وين صاير through the rectum. Different enterocele and rectocele palpate uterosacral ligament, index finger in the vagina and middle finger in the rectum. If rectovaginal examination is performed, any rectal finding should be recommended. إذا أنا سويت rectal examination لازم finding any hemorrhoid, rectal mass, if indicated, stool on the examination gloves should be tested for occult blood loss. However, a single sample does not sufficient for colorectal cancer screening. Screening is better accomplished by home collection of stool sample. إذا توقعت أنا شنو عندي مثلا CA cervix metastasized where to the rectum or any colorectal cancer as a coexistent disease, so stool collection. When performing the rectovaginal examination, using lubricated examination gloves and asking the patient to strain against the examiner finger will usually allow the sphincter to relax and decrease discomfort. The same finger should not be used to examine both the vagina and the rectum and to avoid transmission of human papillomavirus or contaminated with the blood, which may alter fecal occult blood testing performed. إذا أريد أسوي rectovaginal examination الفنجر اللي أفحص به الفاجينا ما أفحص به الركتم، والفنجر اللي أفحص به الركتم ما أفحص به الفاجينا. أرجع وأقول لكم هاي المحاضرة مجرد ترجعون تقروها تعريفية لكل مواد الجاينيكولوجي. أكيد راح تنسأل. سابقا كنا ندرس الطلاب صف خامس بالاوت بيشنت ديبارتمنت، لذلك من نحكي هاي المحاضره حتى يعرفون شنو انكونتيننس اللي يدخلون سيشنات بالبدايه. حاليا يعني صار سياسه قسم او سياسه كليه انه ماكو اوت بيشنت يعني ستدي، سو this lecture giving to you يعني تعرفها وما مطالب بها كاكزام حتى تعرف كل الديزيز اللي راح تدرسه. اوكي، محاضره قصيره وتعريفيه بس لازم تكون ملم بيها تعرفها شنو هي. اوكي، thank you very much.